Hi everyone, welcome back to another episode of the HT Physio Quick Tips series. My name is Will Harlow and I'm the Over-Fifties specialist here at HT Physio in Farnham. And today we're going to be talking about some of the most common causes of pain on the outside of the knee. So when we're talking about pain on the outside of the knee, we're talking about pain out here, okay? So on this outside portion of the leg. And there are several causes for this problem, and the most common causes, they number in about 6 different issues. Okay, so we're going to talk about each one in turn and then how to differentiate between them when trying to work out what's causing pain on the outside of your knee. So to give me a hand, I've got my knee model here just to help me explain the issues. So in this model, this is the outside of the knee. So when we're talking about pain on the outside of the knee, it's around this region here. And to start off with, it's worth us just looking at what we've got on the outside of the knee. So here we've got something called the lateral collateral ligament, or the LCL for short. We've also got the lateral meniscus, which you can see in here, which is like a layer of cartilage. We've also got the fibular bone here. And of course, we've got the main joint between the thigh bone and the shin bone as well. Now, the first and most common cause of pain on the outside of the knee is arthritis. And arthritis is basically just a term that's used to describe the thinning of the cartilage. And for many people, it happens on the inside of the knee, but it's also likely to happen on the outside as well. So if you have a vague, dull, achy pain here on the outside of your knee, that can often be a sign of arthritis. Typically, it's worse in the morning for the first 15 minutes or so, and then when you start to get moving, then it starts to loosen up. So that's a very common cause of pain in that region. Now, similar to that pain there, the second most common cause is what we would call a lateral meniscus tear. Now, for people over the age of 50, a lateral meniscus tear and arthritis can present very similarly. So it would be pain right over the joint, achiness typically, possibly a bit sharper if it was an acute tear, but many people just develop these little tears in this cartilage structure over time, and that can lead to pain on the outside of the knee. One of the key factors, or one of the key symptoms for a lateral meniscus injury is when you rub your finger over the edge of the joint, it'll be quite tender. So it hurts to press your fingers into it, and that can be the sign of a meniscus problem. Now, another injury, and this is actually an injury more so than a wear and tear process over time, is a sprain to the lateral collateral ligament, or the LCL. So this ligament here, that joins the thigh bone to the fibula, so it joins the upper leg to the lower leg and keeps the knee from moving sideways. Obviously, our knees move forward and backwards, they don't move side to side, and one of the reasons they don't move side to side is because we have these ligaments on the outside of the knee. Now, if someone comes up to the inside of your knee and they go like that, that pushes your knee out to the side and it can cause a sprain here. So it's a common sporting injury, but it can also happen from sprains when you're out walking and maybe you slip, or if you fall down a stair and you twist your knee in a funny position, then that can cause an LCL injury as well. So typically, this would not start just out of the blue. It would be an injury that caused it. So that's probably the most common way of determining whether or not it's a ligament problem. And if you were to push in on the inside of your knee, like that, and it caused pain on the outside of the knee, that's a common sign of a ligament injury. Now, another thing that can cause pain on the outside of the knee is irritation to what we call the Patellar Femoral Fat Pad, which lives just here underneath the kneecap. So what this fat pad does is it's basically a structure that lubricates the movement of the knee and makes sure that the knee is healthy. Now, if we have a problem with the way the kneecap is moving, it can rub on the fat pad and it can cause typically pain around the front of the knee, but the pain can also spread just up the outside of the kneecap as well. So it can make it seem like the pain is on the outside of the knee. Now, the symptoms of this problem are usually pain coming down stairs or coming down hills, clicking of the knee when you move it, that can be a common sign of this issue as well, and it can also just throb and ache at rest. Typically there'll also be some swelling if this area is impinged, because it's a very sensitive structure with a lot of blood vessels around it. So that's another really common injury. The next common injury we see, especially in athletes, runners and cyclists especially, we call it Iliotibial band syndrome, or ITB syndrome. Now, your ITB, your iliotibial band, is a very thick band of collagen which runs all the way down from the hip right to the knee. And it is really tough. It attaches around here on the outside of the kneecap and also down onto the shin bone. And usually it's there quite happily, not causing any problems. Now, in people who do a lot of sport and they do a lot of knee bending and straightening in like a repetitive way, if they have a muscle imbalance, that can cause the iliotibial band to start to rub around this area here, and it can start to cause pain on the outside of the knee. So if you're a runner or a cyclist and over time you've started to develop pain on the outside of the knee and you're not really sure what caused it, ITB syndrome could be the culprit. So typically this kind of pain starts when people run or cycle, and it gets worse as they keep going. It's not a very nice problem to have, but luckily it's a physiotherapy problem. It's something we can often help people with. The final cause of pain on the outside of the knee that we're going to talk about today is referred pain from the hip or the lower back. Now, referred pain is the term we use to describe pain in one part of the body when the problem exists in another area entirely. Now, on the outside of the knee, the most common areas to refer pain are either the hip or the lower back or the lumbar spine. And this can happen for two reasons. The first reason is that, quite simply, the brain can sometimes become confused when it's picking up pain messages, so it sees pain as coming from a different area of the body than where the problem actually is. So that's quite common in someone who has hip arthritis. They can often feel pain in their knee. Now, the other reason that people can get pain in a referred part of the body is because a nerve is pinched or irritated. Now, in the lower back, if someone has an irritated nerve, more specifically the L5 nerve, that can actually send pain right down the outside of the leg into the outside of the knee as well. I've got an interesting story that might illustrate the hip type of referral pattern quite well. So I once had a patient who came in a little while ago, and he was complaining of pain on the outside of his knee, quite a horrible, dull, burning pain that was quite constant and woke him up at night. When I assessed his knee, I couldn't find any problems with it. It was moving really nicely. But then when I looked at his hip was incredibly stiff and would hardly move at all. Now, he didn't have any pain in his hip, but I thought something's not quite right here, so we sent him for a scan of his hip and his knee. And the results came back to show that his knee was absolutely fine, but he had really severe arthritis in his hip. So we concluded that the knee pain was probably caused by referred pain. That gentleman went on to have a hip replacement, and that cured the pain on the outside of his knee. So referred pain is very common. It's something we need to be aware of. It's another reason why it's a good idea to be checked out by a professional if you have a problem like this, because a professional can help you identify what's a true injury and what's referred pain. Anyway, so those are all of the common causes of pain on the outside of the knee. I hope that's been an informative video for you. Just to recap, the causes are osteoarthritis, an injury to the lateral meniscus, an injury to the lateral collateral ligament on the outside of the knee, irritation to the patellar femoral joint around the kneecap, ITB syndrome, which is also called runner's knee, and then finally referred pain. If you've enjoyed this video, please hit the like button and subscribe to the channel, because it really helps me reach more people, and also consider sharing this video if you found it useful. And the other thing you can do, if you want more tips like this and some information about how to prevent and treat problems like the ones we've spoken about today, you can pick up a copy of my book. It's called Thriving Beyond 50, and it will give you lots of strategies for getting problems like this better. Anyway, that's all I've got for you today. Thank you very much for watching. I appreciate your time, and I look forward to speaking to you on the next video.